At this place in history, we're on North Prospect Street in Burlington. I'm with Steve Perkins, the Executive Director of the Vermont Historical Society. Steve, good morning.
Good morning. How are you?
Good. Why are we in Burlington?
So we're standing in front of the home of Mary Fletcher, a remarkable woman from Chittenden County, did a lot of really cool things. So we've asked a special guest to come and talk to us today about Mary Fletcher. So Amanda, we've asked a really special guest to join us, Sarah Dopp. So really close to our hearts. She's a board member of the Vermont Historical Society, but she's also past president of the Chittenden County Historical Society. And so she's going to tell us about Mary Fletcher today.
Excellent. Hi, Sarah.
Hi.
All right, so let's start at the beginning. Who is Mary Martha Fletcher?
Okay. Well, Mary was in her time the greatest benefactress in the state of Vermont at that time when she endowed the hospital here in Burlington, which now, of course, we know as the UVM Medical Center. Her father was a merchant in Jericho and in Essex Junction, and Mary was born in Jericho in 1830. He actually made his money, though, not in trading goods, but in investing wisely in some land deals out west. He and his wife, who was also Mary Peasley of New Hampshire, they were married in 1828. And they had 5 children, but 3 of them died very early when they were children. I think both of the parents got a keen sense of the fact that wealth and prosperity doesn't bring happiness necessarily, and they'd experienced just the reverse. So they wanted to do something good with their money, and they began making philanthropic gifts just before Thaddeus died. And he and Mary, his wife, had plans for making gifts to establish a library here in Burlington, which was ultimately done, but not during his lifetime. So after his death, Mary the daughter and Mary the mother got busy in establishing the library downtown, which of course we call the Fletcher Free Library. Mary consulted with Dr. Walter Carpenter at the medical school, and he was Mary's personal physician and had been caring for the whole family since they came to Burlington. And so they began to concoct this idea of establishing a hospital. They saw the need for this, and also Mary saw the need for establishing a training school for nurses. So she endowed that as well. Her father died worth over $400,000, which of course was a huge amount of money at that time. And she used $200,000 to make the initial establishment of the hospital, and then another large gift to establish the training school for nurses. The hospital opened in 1879 in January and admitted the first patient, a New York State patient, interestingly enough, on the first day of opening. She wanted to die in her hospital. So it had been established for some time because Mary died in 1885. She was only 55 years old. Anyway, she was bundled into a sleigh here in the yard by her groundskeeper, Michael Kelly, and trundled up to the hospital. It's not so very far, but with a horse and sleigh, it probably took a little while. And she was put into bed in her room. And so she was carried up there, and she made it before she actually breathed her last.
You know, what would Mary Fletcher think of what we have today, this hospital and the services that they provide?
Well, I hope she would be thrilled. And really she positioned Vermont as a healthcare leader nationwide, and that isn't hyperbole. This was about the 6th or 7th public hospital organized in the United States. It was a very early nurses training school. There were very few at that time. So she was well ahead of the curve. And the way it's developed to today, I think her mind would be absolutely blown. She wouldn't be able to comprehend it. But it's thanks to her generosity and her family's, really. They were lucky in finance, not lucky in their own family circumstances, but she left something good, and also at the library, something enduring that we enjoy today.
At this place in history.